Hi, I'm Jack West, medical oncologist at Swedish Cancer Institute in Seattle, Washington. In a recent video, I discussed the topic of mixed responses in lung cancer, though it applies to many other kinds of cancer as well. Just to briefly backtrack, the concept is that sometimes we will have patients on active treatment who will have a follow-up scan that actually shows a mixed response where some areas of known disease are shrinking, that is, responding to the treatment, but there will be a new lesion or other areas of known disease that are actually growing. So in the prior video, I discussed this question of how we might best approach and manage that situation, but I also wanted to take a moment to cover the question of why this might happen biologically. And so to help explain that, I would say that we know that cancer is a heterogeneous process. It is the product of mutations. That's what makes a cancer. The mutations lead the cancer to grow uncontrollably, to divide quickly, and because of that, the division makes sloppy copies, essentially, that are more prone to developing new mutations. These new mutations can confer resistance of cancer cells to a therapy that was previously effective. And in fact, what you can sometimes see is different areas of the cancer in one person that are responding differently. So in the lung, the cancer can be shrinking on treatment, but new liver lesions can appear, or existing liver lesions may be growing on that same otherwise effective therapy. Well, why does that happen? It's because the molecular profile of the cancer cells in the liver is different from the molecular profile of the lung cancer, of the actual lesions in the lung. And because of that, the treatment that is effective against the lung lesions is not as effective in the liver. Now, I would say that at this point, a lot of what we think we know about this is still more speculative than truly proven, but we are learning more all the time, and that is because we're doing more and more biopsies of different areas of disease. Perhaps at the same moment in time, we might do biopsies of a liver lesion and a lung lesion or a bone lesion and find that there are actually different molecular characteristics in these different areas, which is a humbling thing for us to learn. It's not as simple as this cancer has an EGFR mutation, but it could be that one area does and one area doesn't. And then over time and with treatment, we might see the profile change. And so that is why we are at a point now where we're actively debating the value of repeating biopsies in patients who previously responded to a therapy, but now that cancer is progressing. And we're particularly talking about that in the setting of acquired resistance to a targeted therapy, where someone with an EGFR mutation at the time of diagnosis has, for instance, a very good response to an EGFR inhibitor like Tarceva, erlotinib, and that might last for 10 or 12 or 18 months, but then we start to see a new lesion develop. You might be able to biopsy that particular area and find some different characteristics about that lesion that are not the same as all the other areas that are responding. And perhaps we can focus specifically on treating that new area of disease differently. Now, I did mention in some other discussions and a prior video that at this point, repeating biopsies is not standard and we don't have a proven role that shows an outcome benefit for doing this. But I think it's safe to say that we are learning more all the time and very rapidly about the biology of the cancer from doing more of these biopsies, because we're learning so much about the different molecular oncology features of an individual cancer in a person, but also the different areas that might exist even in one person at the same time or over time and with treatment. What I would also say is that it's very likely that in the future we are going to reach a point where knowing this information will change our treatment plans and lead to better outcomes. So this is an explanation of why a mixed response occurs. At this point, we are just moving toward a point where we might treat different areas of disease differently. We aren't quite there yet, but I think that's coming. Take care. I hope that's helpful.